Namaskar to all of you. Today we will discuss about the antiemetics. We know emetics means vomission and anti means opposite. So no vomission or prevent vomission means antiemetics are the drugs which prevent vomission. So we talk about the classification, locally acting and centrally acting. Locally acting anticholinergics which inhibit the acetylcholine neurotransmitter. For example, glycopyrronium. Glycopyrronium is an important drug in the anticholinergic, and second one is methscopolamine. This is also one. What it cause? It inhibits the gastroenteric secretion and also inhibits the afferent vagal impulses. By these two mechanisms, anticholinergic drug it works as an antiemetic. Second one is prokinetics. We know prokinetics means the drugs which increases the peristalsis and increases the gastric emptying. The drugs are metoclopramide and domperidone. These are the two important drugs in prokinetics. Metoclopramide, we know it can cross the blood-brain barrier, while domperidone cannot cross the blood-brain barrier. These two are also D2 antagonist, means dopamine receptor antagonist. Third one is gastric antacids and local anesthetics. These are also under the locally acting gastric antacids and local anesthetics. So local anesthetics, they desensitize the irritated gastric mucosa. We know that irritated gastric mucosa also cause the vomission. So local anesthetics, by desensitizing the irritated gastric mucosa, they work as antiemetic. Example is benzocaine. And gastric antacids, we know, which inhibits the acidity, which slows down the acidity. If acidity is the cause for the vomission, then antacids will be work. For example, magnesium hydroxide or aluminium hydroxide. Fourth one is demulcent and protectants. Protectants protects the irritated gastric mucosa, and demulcent it will be soothing actions, smoothing action hoga. So these also two under the antidiarrheal drugs. For example, kaolin, pectin and bismuth salts. Now we talk about the central acting drug. Central acting. For central acting, we should know that they block the impulses at emetic center like CTZ or NTS. The antiemetic drugs which are centrally acting, they block the impulses at emetic center like chemoreceptor trigger zone and nucleus tract solitarius. We know that these two areas in the medulla oblongata, they are responsible for the emesis. So chemoreceptor trigger zone and nucleus tract solitarius, they are inhibited by the centrally acting antiemetic drugs. So we should know that what are the neuroreceptors which are involved in the vomission. These are important question. Receptors are the D2 or the dopamine, 5-HT3 means serotonin, M1 means acetylcholine, and H1 means histamine, and NK1 is neurokinin. Neurokinin or NK1 is also known as the substance P. Also remember that. Now talking about the classification, first one is H1 antagonist, means histamine receptor antagonist. Which histamine? Histamine 1. Histamine 1 receptor antagonist. The first one is piperazine drugs. Piperazine, cyclizine and maclizines, they are under the H1 antagonist, which means inhibit the H1 receptors and block the impulses at emetic center like CTZ and NTS. These drugs having the mechanism almost same. Second one is phenothiazine or promethazine. These are the important class of drugs in H1 antagonist. Second one is D2 antagonist. This is quite important, so I also mark star. And the important classification of this is phenothiazine drug. For example, chlorpromazine or recipromazine, we also use this in clinics. Second one is metoclopramide and third one is droperidol. This is important class, D2 antagonist, please remember that. Third one is serotonin antagonist, or with serotonin 5-HT3. You also remember that which T3, T2 or T1. This is T3. Example is ondansetron. This is also important class. Fourth one is M1 antagonist, यानी कि muscarinic receptor 1 antagonist. which inhibits the muscarinic receptor. Example is atropine, and diclomine and scopolamine. Important example. Fifth one is NK1 antagonist, means neurokinin 1 receptor antagonist or substance P. This is also synonym. This is a new class actually, and its control is by the chemotherapeutics agent. For example, aprepitant. This is not in permanently used, but this is a new class, so you should remember in the classification. And if you talk about the miscellaneous drug, glucocorticoids, for example dexamethasone, having the trade name Dexona, cannabinoids, Nebilone. This is less important. You should remember these receptors. Also remember the neuroreceptors in the vomition. So this is a 2 question. The classify antiemetics with suitable examples. This is maybe a short note question, 2 marks, 3 marks or 4 marks. And second one is centrally acting antiemetics. This is also important question, so you must remember that. Thank you.